Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and salam sejahtera to our lovely lecturer and our fellow friend. So we are from group 11. We present about the treatment for toxocariasis. What is toxocariasis? So as we know, the large roundworm, which is ascaroid nematodes of a dog and a cat, are common, especially in puppies and kittens. The three main species that we always heard is about Toxocarasis, Toxocaris leonina, and Toxocaracati. Next. So Toxocarasis infection by roundworm larvae is a zoonotic as it affects human as well. Roundworm eggs from the dog and cat feces are common in soil and outdoor environment. It can cause abnormal blood test result, enlargement of the liver, and sometimes enlargement of the spleen and lymph node. Other symptoms are loss of appetite, muscle and joint pains, abdominal pain, skin rashes, and eye problems. These symptoms are due to migration of the larvae through the organs and tissue. Eye infection may result in loss of vision in the affected eyes. Only rarely does toxocariasis cause severe disease or death. Symptoms may persist for a year or even longer. So how it transmits to the host? Human or animal become infected by eating infected eggs which are found in the soil. Direct through contact with infected soil or indirectly by eating food contaminated with infected soil such as unwashed raw vegetable. The eggs are passed in the feces of infected dog or cat. This egg can remain in the soil for many months to years, but are not infective if they dry out. Once eaten by human or animals, the egg hatch into larvae in the intestine. The larvae penetrate the wall of the intestine and spread to other parts of the body. This migration of larvae causes the symptoms people experience. After eating egg, it takes at least 1 week for symptoms to appear, but it may be weeks or months. Toxocariasis is not transmitted from individual to individual. Direct contact with infected animal will not produce infection, as the egg need to mature for a number of weeks in the soil before they can cause the disease. Next, I will pass to my friend to continue the slide.
So thank you, and now I'm going to talk about most importantly the treatment for toxocarasis. So as we all know, toxocarasis can be transferred from adult to the offspring. So it is most important to tackle the adult for treatment. So perinatal transmission infection actually can be greatly reduced by treating the bitches with several methods. First, daily doses of fenbendazole with 25 mg per kg orally from day 40 of gestation to day 2 after whelping. Secondly, by ivermectin, 0.3 mg per kg subcutaneously on the 0th day, 30th, and 16th day of gestation, and also 10 days after whelping. So thirdly is also ivermectin, but we use 0.5 mg per kg on days 38, 41, 44, and 47 of gestation. And lastly, ivermectin with 1 mg per kg on days 20 and 42 of gestation. So other than treating the adult, it's also very important to minimize the egg output. The pups should be treated as early as possible if they are infected, ideally given 2 weeks after birth and repeated at 2 weeks intervals to 2 months of age, and then continue monthly to 6 months of age. So when you nurse the puppies, the bitches should be treated at the same time. So same goes to cases of kittens, they are infected. And for queens, the transmission can be greatly reduced by treating with a single dose of amodepside and or praziquantel spot on the last week of pregnancy. Other than that, if adult cats or dogs they are not giving birth, but they are infected, they also can be given antiparasitic drugs such as maldomexin, moxidectin, and parental pamoate to kill the adult worm. So next, I'm going to pass to my friends to talk about these drugs' active ingredients.
Okay, so for the active ingredients, the active ingredients for febendazole is benzimidazole, carbamate, and phenolphthalic. And for malbomycin is malbomycin outside, parental palmoate, moxidectin, and imidacloprid. Next, for the dosage, for fenbendazole, the dosage for dogs and cats is 20 to 50 milligram per kg. For malbomycin, both cats and dogs are in tablet form and through oral. For dogs, 0.5 to 2 milligram per kg, and for cats, 2 milligram per kg. For moxidectin, dogs that have a multi-drug resistance 1 gene or MDR1, it is 1.12 milligram per kg, and those who are not with MDR1 gene is 0.03, 0.06, and 0.09 milligram per kg subcutaneously. And for parental pamoate, for dogs, 5 milligram per kg and are given for 3 consecutive days orally. Next, I will pass to my friends to explain more about contradiction.
Okay, moving on, let's talk about the contraindication of the drugs. For fenbendazole, it mostly comes in oral granules or liquid suspension form. This drug is given orally. This liquid must be measured carefully based on the instruction on the label and also according to your vet's consultation. The pets that receive this drug, they must receive the correct amount and not overdose. Next is moxidectin. This drug should not be used in pets that are hypersensitive or allergic to it. Moxidectin should also be avoided for kittens under 9 weeks of age. Next, moving on, we'll see the third drug, which is parental pamoate. Okay, this drug should not be used in dogs that are allergic to parental, ivermectin, or other ivermectin drugs, for example, salamectin and moxidectin. It should also be used with caution in puppies that are less than 6 weeks of age. Dogs or cats that are using this parental pamoate must be tested for heartworm infection. Dogs that are infected with heartworms are at risk of having a serious adverse reaction following the drug administration. This adverse reaction is usually caused by the rapid die-off of immature heartworms. Parental pamoate is used in pregnant and lactating animals as it helps in reducing severity of infection in neonatal animals, but this drug should be used with caution. Next, passing on to my friend.
The next drug we'll be talking about mebendazole, or can be known as mebendazole oxamide. So this drug will be given orally with flavored oral tablet. And this drug also can be given with or without food. So, but if you see your dog or your pet acting like sick or trying to get vomit because of empty stomach, then try to give small amount of food together with this tablet. So this drug should be used in dogs without a current negative heartworm test and puppies less than 4 weeks age, or probably the dogs weigh less than 2 pounds, which is similar to 900 grams. And also cats cats less than 6 weeks of age, or kittens weighing less than 1.5 pounds, which is about 680 grams. Next, I will briefly explain to you about the importance of human. As you may all know that this helmet can cause zoonotic disease to the human as well. And humans are not natural hosts. Maybe, but may become infected accidentally by ingesting the egg from the soil. So basically, the kids are very vulnerable in this situation. And for this disease, the standard treatment is basically 5 days course of albendazole, and sometimes it will be supplemented with corticosteroid to suppress or to reduce the allergic reaction to the roundworms. And for the OLM basically the ocular larva migraine, which is the one that's showing in the diagram. It is basically to cure it, or the treatment for this disease is that you have to go through surgery and then have to take some steroids and also undergo chemotherapy, which is antihelmintic or antiparasitic. So that's all from us. That's all about treatment about toxocarasis, and these are the reference that we used for our research. Till then, thank you so much.